Animal rights advocacy often involves a balance between the rights of animals and the societal needs of humans. Can you explain how animal care providers should navigate situations where the welfare of an animal is at odds with the interests of the animal's owner using a case study scenario? Answer: in situations where an animal's welfare conflicts with the owner's interests, animal care providers must adhere to both ethical standards and legal regulations governing animal welfare. A key principle in these cases is the best interest of the animal, which is central to animal care ethics. If an animal is in distress due to poor living conditions, an animal care provider must prioritize the animal's well-being over the owner's wishes. For instance, if an animal is being subjected to neglect or abuse, the provider has an ethical obligation to intervene, even if it means reporting the situation to authorities. Legal frameworks such as the Animal Welfare Act in many regions require care providers to act when animal abuse or neglect is suspected. They are also guided by professional codes of conduct, which often mandate reporting to relevant authorities in cases of mistreatment. Ethically, a provider must also weigh the harm-benefit analysis, whether the intervention will improve the animal's quality of life and whether the benefits of intervention outweigh potential harm to the animal. In sum, an animal care provider should always advocate for the animal's rights, even if it leads to conflict with the owner. In the context of animal care, ethical dilemmas often arise when providers must decide between treatment options that may cause varying levels of pain or distress to an animal. What ethical framework should an animal care provider use when choosing between two such options? Answer: when faced with ethical dilemmas related to pain and distress, animal care providers should use a utilitarian ethical framework which focuses on minimizing harm and maximizing overall well-being. This framework requires careful consideration of the animal's physical and psychological state, the severity of potential harm from each treatment, and the likely benefits. Providers should also consider deontological ethics, which holds that certain actions, such as causing unnecessary harm, are inherently wrong regardless of the outcomes. The Five Freedoms model for animal welfare is highly relevant in these scenarios. It emphasizes the importance of freedom from hunger and thirst, freedom from discomfort, freedom from pain, injury, or disease, freedom to express normal behavior, freedom from fear and distress. In practical terms, providers should assess which treatment option best respects the animal's dignity, minimizes suffering, and provides the best possible outcome. An animal care provider in a shelter suspects that a potential adopter is not equipped to care for a pet despite appearing to meet basic requirements. What legal and ethical considerations should the provider take into account before approving the adoption? Answer: before approving an adoption, the animal care provider must balance the legal responsibilities outlined in adoption policies with ethical obligations to the animal's welfare. Legal considerations include ensuring compliance with adoption contracts, which often specify conditions under which the adoption is valid. These contracts typically contain clauses about the adopter's commitment to provide a safe environment and proper care for the animal. Ethically, the provider should assess whether the adopter can genuinely meet the five freedoms for the animal. If the provider suspects that the adopter may not be capable of providing for the animal's needs, such as medical care, sufficient space, or companionship, they have a moral obligation to refuse the adoption. They may also be required to consult with a supervising veterinarian or behavioral specialist to assess the suitability of the adopter and recommend any additional support or training the adopter may need. In some regions, animal shelters must also comply with local animal control laws, which require the provider to ensure the adopter has sufficient resources and understanding to care for the animal responsibly. How should an animal care provider approach the administration of medications to a frightened or aggressive animal? Discuss the ethical considerations, especially concerning the well-being of the animal and the safety of the provider. Answer: administering medication to a frightened or aggressive animal requires careful planning to ensure both the safety of the animal and the provider. The ethical principle of non-maleficence, which means do no harm, must be central in this situation. Providers must ensure that any restraint or sedation used does not cause undue stress or harm to the animal. Sedation protocols should be carefully chosen, considering the least invasive method of restraint while still achieving the goal of medication administration. When dealing with aggressive or fearful animals, positive reinforcement techniques should be prioritized to reduce fear and anxiety. These techniques can include offering treats, calming environments, or employing behavioral modification strategies to make the experience less traumatic. If the animal's fear or aggression could potentially lead to injury of either the animal or the provider, sedation may be necessary. However, any sedative administration must follow prescribed dosages and adhere to veterinary protocols to ensure the safety of the animal. Additionally, any medication administration should be documented in the animal's medical records to ensure transparency and accountability. Mr. Martinez, an animal care provider at a wildlife rehabilitation center, is monitoring a newly admitted hawk with a suspected wing fracture. The hawk has been exhibiting signs of stress, such as rapid breathing and elevated heart rate. What steps should Mr. Martinez take to monitor the hawk's vital signs, and how should he document his observations? Answer: Mr. Martinez should first ensure that the hawk is placed in a quiet and low-stress environment to minimize further anxiety or distress. Given that the hawk is showing signs of stress, Mr. Martinez should use non-invasive methods to monitor vital signs, including measuring the animal's heart rate, respiratory rate, and body temperature. A stethoscope and thermometer designed for avian species should be used to get accurate readings. Heart rate: the normal heart rate for a hawk ranges from 300 to 400 beats per minute. Mr. Martinez should check this by placing a stethoscope on the chest or through palpation at the femoral artery. Respiratory rate: the normal respiratory rate for a hawk is typically 1 to 1.5 breaths per minute. Rapid breathing may indicate pain, distress, or a need for oxygen support. Body temperature: avian body temperature is generally higher than that of mammals, with a normal range of 104 degrees to 107 degrees. A thermometer designed for birds should be used to avoid causing injury or distress. Mr. Martinez should document all observations in the hawk's medical record, including the date and time of monitoring, vital sign readings, and any changes in the hawk's condition. What are the key principles an animal care provider should consider when assessing whether an animal's quality of life is being maintained, especially in long-term care situations? Answer: when assessing an animal's quality of life, animal care providers should consider several principles. Physical comfort: this involves ensuring the animal is pain-free and not suffering from illness or injury. Effective pain management strategies, such as regular assessments and medication, are essential. Emotional well-being: the animal's ability to express natural behaviors such as socialization, exploration, and rest should be monitored. Anxiety, stress, or depression may be signs that the animal's emotional well-being is compromised. Independence and mobility: an assessment should determine if the animal is able to move, freely engage with its environment, and perform activities it once enjoyed. In cases of injury or illness, accommodations should be made to ensure the animal's continued activity, such as mobility aids or assistive devices. Environmental enrichment: providing a stimulating environment is vital for preventing boredom and stress. The animal should have access to appropriate enrichment based on its species-specific needs, nutrition, and hydration. Ensuring the animal is properly fed, hydrated, and at a healthy weight is critical to maintaining its quality of life. What is the role of an animal care provider in advocating for broader legislative changes regarding animal welfare, and how can they effectively participate in the process? Answer: an animal care provider plays a crucial role in advocating for the improvement of animal welfare laws. Their position allows them to draw upon their professional expertise and first-hand experiences with animals to inform policy decisions. Providers should engage in evidence-based advocacy, using their knowledge of animal behavior, welfare standards, and care practices to support legislation aimed at improving conditions for animals. To effectively participate in the legislative process, animal care providers can collaborate with advocacy groups, partner with established animal welfare organizations to strengthen their collective voice and have a greater impact on policymakers, provide expert testimony, offer testimony during hearings, or submit research findings to legislative bodies to influence the development of laws that protect animals, engage the public, educate the public on animal welfare issues through awareness campaigns, educational programs, and media appearances to build public support for necessary legislative changes, lobby for change, engage in direct lobbying with lawmakers, offering practical recommendations for policy improvements and advocating for stricter enforcement of existing animal welfare laws. What are the key legal and ethical requirements for maintaining an animal's medical records, and how should an animal care provider ensure compliance? Answer: maintaining accurate and complete medical records is a critical responsibility for animal care providers, both for legal and ethical reasons. Legally, providers must comply with local data protection laws, such as GDPR in Europe or HIPAA in the US, that govern the handling and storage of personal information, even when it pertains to animals. This means medical records must be securely stored, with access limited to authorized personnel only. Ethically accurate records are essential for ensuring continuity of care, fostering trust with pet owners, and facilitating communication with veterinary professionals. Medical records should include history: a detailed record of the animal's medical history, including previous treatments, surgeries, and vaccinations. Treatments and procedures: documentation of all medical treatments, medications, and procedures administered, along with dosages, timing, and any reactions or complications. Observations: A record of any behavioral or physical changes noted by the animal care provider during routine examinations or while administering care. Providers must also ensure confidentiality and transparency in medical record keeping, documenting any interactions with the animal owner or other care staff. When assisting with surgical procedures, what are the critical protocols and ethical guidelines that an animal care provider must follow to ensure patient safety and minimize risks? Answer: when assisting with surgical procedures, animal care providers must adhere to a strict set of protocols and ethical guidelines to ensure the animal's safety and well-being. These include sterilization, ensuring that all equipment and instruments are properly sterilized to prevent infection. This includes adhering to strict aseptic techniques during preparation and the surgical process. Anesthesia monitoring, regular monitoring of the animal's vital signs, including heart rate, blood pressure, oxygen levels, and temperature throughout the procedure to prevent complications. Pre-op assessments, conducting thorough preoperative assessments to evaluate the animal's overall health and suitability for surgery. This includes taking a detailed medical history and performing diagnostic tests such as blood work or imaging. Post-op care, following ethical guidelines to provide post-operative care, including pain management, monitoring for complications, and ensuring a safe recovery environment. Ethically, the animal's best interest must always guide decisions. Providers must ensure that the procedure is in line with the principles of non-maleficence, avoiding harm and beneficence, maximizing benefits. If a procedure presents significant risks, the provider should discuss alternatives with the veterinary team and pet owner. What steps should an animal care provider take to ensure that sterilization procedures for surgical equipment are properly followed, and how does this relate to ethical considerations in animal care? Answer: sterilization procedures are critical for ensuring that surgical equipment is free from pathogens that could harm animals during procedures. To ensure proper sterilization, the following steps should be taken. Cleaning: thoroughly clean all instruments to remove organic material before sterilization. Sterilization methods: use appropriate sterilization techniques, such as autoclaving, chemical sterilization, or gas sterilization, depending on the type of equipment. Monitoring: regularly monitor sterilization equipment for proper function, including using chemical indicators or biological tests to confirm sterility. Storage: store sterilized instruments in a clean, dry environment to prevent recontamination. Ethically, these procedures are essential for minimizing the risk of post-operative infections and ensuring the safety of the animal. By following proper sterilization protocols, the animal care provider demonstrates a commitment to the highest standards of care and protection for the animal, aligning with ethical obligations to do no harm. Explain why timing is critical in positive reinforcement when training animals. How can poor timing affect the animal's learning process, and what methods can be used to improve timing? Answer: timing is crucial in positive reinforcement because the association between the animal's behavior and the reward needs to be clear and immediate. If there is a delay between the desired behavior and the reward, the animal might associate the reward with an unintended behavior occurring after the desired action. For instance, if a dog sits on command but is rewarded several seconds later while it stands, the standing action might be reinforced instead of sitting. To improve timing, trainers can use a marker or clicker. A clicker provides an instantaneous signal marking the exact moment of correct behavior. Practice observation skills. Trainers should sharpen their ability to recognize behaviors quickly, apply the PROMAC principle, use high probability behaviors as reinforcers immediately following low probability desired actions. Maria is responsible for cleaning an animal shelter that houses both healthy and sick animals. One day, she accidentally uses the same mop in both areas without proper disinfection. Later, several healthy animals show signs of illness. What protocol should Maria have followed to prevent disease transmission, and how should the situation now be addressed to contain the outbreak? Answer: Maria should have adhered to strict biosecurity protocols to prevent cross-contamination. Dedicated cleaning equipment, use separate mops, brushes, and cleaning supplies for healthy and sick animal areas. Disinfection procedures, equipment used in areas with sick animals should be disinfected with an appropriate agent, e.g. diluted bleach of 132 concentration for surfaces. Order of cleaning, always clean healthy areas first and sick areas last. Actions to contain the outbreak: isolation, quarantine newly infected animals immediately. Enhanced sanitation, implement a deep cleaning protocol throughout the facility, including air filters and drains. Veterinary intervention, conduct diagnostic tests to identify the pathogen and treat affected animals. Regulatory guidance, follow the National Animal Health Program, not guidelines for biosecurity and sanitation practices in animal facilities. Describe how counter-conditioning is used to address fear-related behaviors in animals. Provide an example involving a dog afraid of vacuum cleaners. Answer: counter-conditioning replaces an undesired emotional response, e.g., fear, with a positive one by associating the fear-inducing stimulus with a pleasant outcome. Steps for counter-conditioning a dog afraid of vacuum cleaners: introduce the vacuum at rest, place the vacuum at a distance where the dog remains calm, and reward with high-value treats. Gradual desensitization: slowly move the vacuum closer while rewarding calm behavior. Add movement without noise. Push the vacuum without turning it on, continuing to reward the dog. Introduce noise gradually. Turn the vacuum on briefly. A low distance, pairing the sound with rewards. Regulatory guidance: training methods must prioritize the animal's welfare, as outlined by the International Association of Animal Behavior Consultants (IAC), which emphasizes stress-free techniques. Critically evaluate the use of head collars versus prong collars in managing leash-pulling behavior in dogs. Discuss their ethical implications. Answer: head collars work by redirecting the dog's head, naturally limiting pulling. They are humane and effective when fitted properly, but may require acclimation for the dog to feel comfortable. Prong collars apply pressure around the neck to discourage pulling, but can cause pain, injury, and stress if misused. Many animal welfare organizations, such as the ASPCA, strongly discourage their use due to their punitive nature. Ethical implications: head collars align with ethical training principles because they rely on guidance rather than punishment. Conversely, prong collars may violate welfare standards, emphasizing the importance of using tools consistent with the AVSAB's guidelines for humane training. Ryan recently adopted a 10-week-old kitten and is unsure how to ensure proper socialization. The kitten hisses at strangers and hides during playtime. What steps should Brian take to improve the kitten's socialization, and what risks arise if socialization is delayed? Answer: steps for socialization: introduce gradually, expose the kitten to new people, environments, and gentle handling in short sessions. Positive experiences: pair exposure to new stimuli with rewards, e.g., treats, toys. Controlled socialization with animals: introduce well-socialized pets under supervision to avoid negative interactions. Use play therapy. Encourage interactive play to build confidence. Risks of delayed socialization: increased fearfulness, aggression, or stress in adulthood, difficulty adapting to new situations or environments. Regulatory guidance: early socialization aligns with the humane treatment guidelines recommended by the American Association of Feline Practitioners. Discuss the factors that influence the effectiveness of disinfectants in animal care facilities. How can these factors be managed to ensure thorough sanitation? Answer: factors influencing disinfectant effectiveness. Contact time: allow adequate time for the disinfectant to act as specified by the manufacturer. Surface cleanliness: pre-clean surfaces to remove organic matter, which can deactivate disinfectants. Dilution accuracy: use the correct concentration to ensure efficacy without causing harm. Temperature and pH: disinfectants often have optimal temperature and pH ranges for effectiveness. Management strategies: train staff on proper application techniques. Use validated products listed under the Environmental Protection Agency (EPA) guidelines for animal facilities. Explain how inconsistent reinforcement during training can lead to behavioral issues in animals. Answer: inconsistent reinforcement during training can lead to confusion and frustration in animals, as they fail to understand which behaviors are desirable. When rewards are given unpredictably, animals cannot reliably predict what will earn them reinforcement, causing them to either exhibit random behaviors or develop problem behaviors. For example, a dog that is sometimes rewarded for sitting and sometimes ignored will struggle to understand that sitting is the desired behavior. The unpredictable nature of reinforcement creates a variable schedule which, while it can sometimes make a behavior more resistant to extinction, can also lead to anxiety, impulsiveness, or aggression in certain animals. Inconsistent reinforcement may also foster learned helplessness if the animal's behavior is ignored or punished without any feedback, which is detrimental to training. Solution: consistent reinforcement should be used initially to help the animal understand the connection between its behavior and the reward. Once the behavior is learned, a shift to variable reinforcement, rewarding occasionally, can maintain the behavior without making it overly reliant on constant reinforcement. This approach aligns with ethical training methods that emphasize clear communication and positive reinforcement. What are the key principles of preventing zoonotic disease transmission in an animal care facility? Answer: preventing zoonotic disease transmission is critical for the safety of both animals and humans in an animal care facility. The following key principles help minimize the risk. Hygiene practices: Proper hand hygiene, including frequent hand washing with soap or using alcohol-based sanitizers, significantly reduces the transmission of pathogens from animals to humans and vice versa. Personal protective equipment (PPE). Staff should wear appropriate PPE, such as gloves, masks, gowns, and boots, particularly when handling animals that may be ill or suspected of having zoonotic diseases. Isolation protocols. Animals that are suspected or confirmed to have zoonotic diseases should be isolated from healthy animals to prevent cross-contamination. Vaccination. Ensuring both staff and animals are vaccinated against common zoonotic diseases like rabies is essential. Regular vaccination schedules should be followed to maintain immunity. Environmental sanitation. Frequent cleaning of surfaces, cages, and common areas helps to reduce the spread of pathogens, and the use of disinfectants must be according to manufacturer guidelines. Describe the best practices for managing hazardous waste in an animal facility. Answer: proper hazardous waste management in an animal facility is crucial to ensure the safety of staff, animals, and the environment. Best practices include segregation. Waste should be separated into categories: hazardous, contaminated needles, chemicals, euthanasia drugs, and non-hazardous waste. Proper storage. Hazardous waste must be stored in leak-proof, secure containers that are clearly labeled, ensuring they are easily identifiable to prevent accidental exposure. Disposal methods. Follow legal and safety protocols for disposing of hazardous waste. Some materials may require incineration or be disposed of through a licensed waste disposal company specializing in hazardous materials. Training. Staff should be trained on the types of hazardous waste in the facility, proper handling methods, and emergency procedures in case of spills or exposure. Regular audits. Periodically audit waste management practices to ensure compliance with local and federal regulations, such as the Resource Conservation and Recovery Act. Emily's dog, Max, barks excessively when left alone. Emily tried scolding Max but saw no improvement. What is the likely cause of Max's behavior, and how can Emily address it effectively? Answer: Max's excessive barking when left alone is a common sign of separation anxiety, the condition where dogs become anxious when separated from their owners. This behavior is often triggered by stress and fear of being alone, and scolding may worsen the anxiety rather than solve the problem. Steps to address the behavior: gradual desensitization. Emily should begin by leaving Max alone for short periods and gradually increasing the time. This process allows Max to adjust without becoming overwhelmed. Positive reinforcement. Reward Max with treats and praise for calm behavior when alone. This helps him associate solitude with positive experiences. Interactive toys and comfort items. Provide Max with toys or comfort items like a blanket that smells like Emily to keep him occupied and reduce stress. Create a safe space. Establish a designated area for Max that feels secure, such as a crate or a quiet room with his favorite items. What are the critical design principles for enclosures housing animals with diverse behavioral and physical needs, such as arboreal and terrestrial species in a shared space? Answer: designing enclosures for animals with varying behavioral and physical needs requires a balance of species-specific accommodations to ensure safety, comfort, and well-being. Zoning the enclosure. Arboreal species require vertical spaces with climbing structures like branches or ropes. Materials should mimic natural substrates, ensuring non-toxic, sturdy construction. Terrestrial species require flat, expansive areas with soft bedding, hiding spaces, and pathways that facilitate natural movement patterns. Environmental enrichment. Incorporate species-specific enrichment such as nesting boxes for arboreal animals or burrowing materials for terrestrial ones. Separation and compatibility. Consider species compatibility to reduce stress and aggression. Barriers or zones can prevent interspecies conflicts. Ventilation and climate control. Ensure proper airflow to meet the needs of both species using microhabitats if temperature and humidity requirements differ. Why is maintaining precise temperature and humidity critical for reptiles, and how does failure to do so affect their health? Answer: reptiles are ectothermic, relying on external temperatures to regulate their body functions. Temperature control supports metabolic processes such as digestion and immune function. A temperature gradient allows for thermoregulation, preventing issues like metabolic bone disease or respiratory infections. Humidity control essential for hydration and skin shedding. Low humidity can lead to dehydration and incomplete shedding, while excessive humidity can cause respiratory infections or fungal growth. Failure to maintain these parameters violates the 5 freedoms of animal welfare, particularly freedom from discomfort. Dr. Helen is overseeing a pregnant dog bitch in her 3rd trimester. The dog is housed in a kennel with multiple other animals. Dr. Helen observes that the dog has begun nesting behavior but appears stressed by the other dog's activity. What steps should Dr. Helen take to ensure a safe birthing environment? Answer: Dr. Helen should provide isolation. Move the pregnant dog to a quiet, private whelping area to reduce stress. Stress during late pregnancy can lead to complications like premature labor or failure to bond with pups. Prepare the whelping box. Use soft, clean bedding to cushion the mother and pups. Ensure the area is easily sanitizable and free of hazards. Monitor temperature. Keep the area at 25-30 to prevent hypothermia in newborns, gradually reducing it after the first few weeks. Provide hydration and nutrition. Offer high-calorie, nutrient-dense food to support milk production. Supervise the birth. Observe for signs of dystocia, e.g., prolonged labor without progress, and prepare for veterinary intervention if needed. Ethical guidelines mandate prioritizing the health and comfort of both the mother and offspring. Describe the steps for managing a hypothermic neonate immediately after birth, including the underlying physiological reasons. Answer: hypothermia in neonates can rapidly lead to life-threatening complications due to their immature thermoregulatory systems. Immediate warming. Place the neonate in a warm incubator, 3-2-3-5 dick, or use a heat lamp. Avoid direct heat to prevent burns. Monitoring. Use a rectal thermometer to ensure gradual warming, aiming for normal temperatures. G37 dick in puppies. Hydration and glucose. Administer warm fluids. G1 lactated Ringer's solution subcutaneously. Hypoglycemia is common in hypothermic neonates, necessitating glucose supplementation. Stimulate circulation. Gently massage the neonate to improve blood flow. Restore feeding. Only reintroduce feeding once the neonate is normothermic, as cold neonates cannot digest food effectively. What factors should be considered when selecting substrates for burrowing rodents, and why are inappropriate substrates detrimental to their health? Answer: factors to consider include dust-free materials, prevent respiratory issues common in rodents, such as chronic respiratory disease (CRD), non-toxic composition, avoid cedar or pine, which contain phenols that can irritate the respiratory tract, comfort and insulation. Soft substrates like aspen shavings or paper-based materials support burrowing behavior and thermoregulation. Absorbency. High absorbency prevents the buildup of ammonia from urine, reducing respiratory risks. Inappropriate substrates can cause stress, illness, and behavioral problems, violating welfare standards. How can lighting schedules be optimized to reduce stress in nocturnal animals housed in captivity? Answer: nocturnal animals are highly sensitive to light cycles, and an inappropriate lighting schedule can cause significant stress and disrupt natural behaviors. Here are the key considerations for optimizing lighting schedules. Dimmable lights. Use dimmable lights to simulate natural transitions between night and day. Sudden changes in lighting can cause stress, leading to disturbed sleep patterns or behavioral problems. A gradual dimming of lights mimics dusk and dawn. Low-intensity night lights. For nocturnal species, use low-intensity red or blue spectrum lights. These colors have minimal impact on their circadian rhythms, allowing for activity during the night without disruption. Light cycles. Maintain consistent light cycles, e.g. 12-12 or 10-14 light. Dark to prevent stress caused by irregular day-night transitions. The lighting should match their natural habitat to promote normal sleep-wake cycles. Disruption of circadian rhythms can lead to increased anxiety, behavioral changes, and poor health outcomes, as nocturnal animals rely on darkness to rest and forage during their active periods. Explain the key ethical considerations in breeding programs for companion animals and how these principles mitigate health and welfare issues. Answer: ethical breeding is essential to promote the health and welfare of both the breeding animals and their offspring. The key ethical considerations include genetic screening. Ethical breeders screen for genetic disorders to avoid passing on hereditary conditions. By testing for common breed-related diseases, breeders can reduce the incidence of suffering in future generations. Breeding frequency. It is important to limit the number of times an animal is bred to avoid physical and emotional exhaustion. Frequent breeding can lead to health complications like uterine infections or malnourishment. Overpopulation prevention. Ethical breeding involves ensuring there is a demand for the offspring, preventing the overpopulation of animals. Unplanned breeding exacerbates the problem of homeless pets. Socialization. Puppies and kittens should be raised in environments that support positive human interaction and early socialization to prevent behavioral issues later in life. Ethical guidelines emphasize the importance of animal welfare as outlined by organizations such as the American Kennel Club Act to ensure that breeding programs prioritize the health, safety, and well-being of all animals involved. Why is a rotation system critical in cleaning enclosures for animals prone to zoonotic diseases, and how should this be implemented? Answer: a rotation system is crucial in minimizing the spread of zoonotic diseases in animal care environments. Zoonotic diseases can be transmitted from animals to humans, making proper cleaning and disinfecting protocols essential. Step-by-step cleaning: a rotation system ensures that animals are housed in one part of the enclosure while the other areas are clean. This reduces the risk of cross-contamination during cleaning processes. Use proper disinfectants. Disinfectants should be chosen based on their effectiveness against zoonotic pathogens like Salmonella or E. coli while ensuring they are safe for the animals. Products like bleach or veterinary-approved disinfectants are commonly used. Drying and ventilation. After cleaning, enclosures should be thoroughly dried to prevent moisture buildup, which can harbor bacteria and fungi. Proper ventilation is essential to allow for the evaporation of moisture and to maintain air quality. By using a rotation system, the risk of exposure to harmful pathogens is minimized and proper hygiene is maintained, ultimately contributing to the health and safety of both animals and caregivers. Why is estrus synchronization beneficial in breeding programs, and what methods are commonly used? Answer: estrus synchronization in breeding programs ensures that all females are in heat at the same time, which allows for controlled and efficient breeding. The main benefits include efficient use of resources. Synchronizing estrus allows for more organized breeding, ensuring that both time and veterinary resources are optimized. Improved pregnancy outcomes. Coordinating breeding ensures that all females are in their most fertile window, which can lead to higher pregnancy rates and healthier pregnancies. Reducing stress. Synchronized breeding helps reduce stress for both the animals and the caregivers by eliminating the need for constant monitoring of individual estrus cycles. Common methods of estrus synchronization include hormonal treatments, the administration of prostaglandins or progestins to induce or control the estrus cycle, natural methods, altering light exposure or using pheromones from male animals to trigger estrus in females. What are the potential consequences of improper temperature and humidity regulation in an animal facility, and how can these be prevented? Answer: improper temperature and humidity control in an animal facility can lead to a variety of health and behavioral problems in animals. Thermal stress. Temperature extremes, both too hot and too cold, can lead to thermal stress. The animals may become lethargic, experience metabolic disruptions, or even die from heat stroke or hypothermia. Prevention. Facilities should maintain optimal temperature ranges for the species housed G1824 for most mammals and provide adequate heating or cooling systems to prevent extreme temperature fluctuations. Respiratory issues. High humidity levels can promote mold growth and bacterial infections, while low humidity can lead to dehydration and respiratory distress. Prevention. Maintain appropriate humidity levels, 30–70% for most species, and use humidifiers or dehumidifiers as necessary. Regular ventilation and monitoring are essential. Behavioral changes. Extreme temperatures or poor air quality can cause stress, aggression, or abnormal behaviors such as excessive grooming or self-mutilation. Prevention. Provide species-specific environments with natural light cycles and appropriate environmental enrichment to reduce stress. Effective temperature and humidity control reduces the risk of health issues and promotes animal well-being, aligning with the guidelines provided by organizations like the American Association of Zookeepers (OSC) and the National Institutes of Health (NIH).